Hey there, if you're studying for the CHC, let's do some practice questions together. My name is Huang. I'm an occupational therapist and certified hand therapist. And over 5 years ago, one of my very first programs was the exam prep program to get people to study and pass the CHG exam. And now today, I just published the ultimate book of practice questions, and she thick, okay? She's got about 800 questions or more in there, and it's all divided into the topics. Like the way I teach the exam prep, I believe in having to learn foundational knowledge, right? And chunking things out so it's just easier for you to study. Hands, wrists, tendons, and now we're gonna do burns and wounds. And those are the questions that we're gonna go into today. So let's do a couple of questions together, right? So inside this book, there's a how to use this practice question book, and inside it, I've got frameworks, I've got tips, and I share with you how I chunk things down. And this is a pure example of how I chunk it down. So let's go into burns and wounds. Now, burns and wounds. The reason why it's chunked up into burns and wounds is because you've already learned about hands, wrists, and tendons. Burns and wounds, really think about it. If you get a burn, what happens? And so majority of people with hand burns and injuries, it's to their hands, and so all of that is affecting. Now, obviously burns are very specific and then wounds are very specific. This is just information that you have to learn that now is stacked upon your knowledge of hands, your knowledge of wrists, and your knowledge of tendons, right? So if you didn't do the other questions, study the other questions, do the other questions, and then come back to this chapter, and we're going to share some videos. So give me a moment. Let me pull up my screen. All right, let's go into these 5 questions. I'm going to share with you the questions first, and then we'll do questions and answers, because this is what the book does. I don't give you the answers right below. One of my recommendations is to study the topic and then do practice questions. Study the topics and do practice questions. And that way, it's not just quizzing yourself. You really are learning what areas you're strong in. So how do you use your strength to help you even further? What are your areas of weakness? Because we have to understand that too, so that we can go and do a deeper review in terms of what our weaknesses are. And then the practice questions allow us to mentally practice the reading and the picking, the decision-making process, essentially. When you do practice questions, not only are you learning, like, you're pacing, you're reading the questions, you're thinking through, but the decision-making process is going to be really huge, because you have to apply all the information that you are learning into, like, hey, this is what I would do if I had this type of particular case, right? Now, some of the questions you might see in the first 5 are, maybe a little bit easier, maybe a little bit straightforward. I'm just buttering you up, babe. I'm just buttering you up, because this shit gets harder, all right? So, I don't know, I kind of scrambled it around and kind of put the questions out there, but all right. Question number 1, you place a hot pack on your patient's wrist. They tell you it's too hot. At what temperature does tissue damage begin? A, 101 degrees, B, 107 degrees, C, 132 degrees, D, 113. Now, this is a simple general question answer. One of the reasons why this is important, this actually might come easier to people who worked in a hospital setting. Like, I worked in a hospital setting, and so I always had to take temperatures of freaking everything. So that came to me really quickly, just because I remembered it. But if you work in a private practice and you don't do those measurements, like I have a private practice now, we never measure shit. Like, we don't have to, worry about CARF and those other credentialing bodies. And so you tend to forget these questions might come up, right? And then sometimes these questions are embedded with like treatment questions. And so that's why you need to know some of these, right? All right. So I'm going to read the questions, and then if I go too fast, you can pause on my face. And then that way our videos won't be so long. But think about each question can take you a little bit over a minute, right? But then you have some questions like that might be faster. So if it takes you less time, then you can spend more time on some of the questions that are harder. All right, number 2. Your patients were coming from a digital reconstruction using a local flap. Oh yeah, I forgot to say, like, wounds part is like understanding flaps, grafts, and all that good stuff. All right. They're recovering from a digital reconstruction using a local flap. The flap is being monitored for viability, swelling, and venous congestion. When are you allowed to begin introducing desensitization techniques? A, immediately post-op, B, after 5 days, C, after 2 weeks, and D, after 6 weeks. Question number 3. You receive a script from a new patient that states wound care needed. When the patient arrives, you notice black wounds. What is the best intervention for black wounds? A, clean the area with mild soap and water. B, cover the wound and send the patient back to the doctor. C, use topical antibiotics to soften up the eschar for debridement. And D, use occlusive dressings to absorb the excess drainage. Pause. Right. Number 4, your patient gets ready to start therapy 6 weeks post-surgery to thumb IP. When he arrives for his evaluation, he tells you he hasn't seen the doctor in 6 weeks and is still wearing the original bandage from his surgery. When you remove the bandage, you notice black and red wounds, redness and swelling over the stitches in the thumb, radiating to the thenar and hypothenar area. That's warm to the touch, foul odor coming from his hand. How do you proceed? I wonder where those stories are coming from. All right, A, you tell the patient you suspect he has an infection and inform the MD immediately. B, you refer the patient to a wound care nurse. C, you put a hot pack over the area to check range of motion of the thumb and fingers. And then D, you clean the site with sterile saline water and tell him to wash his hands with mild soap and water daily. All right, question number 5. The patient arrives in your clinic with a yellow wound over the incision scar. Which of the following is the best way to address yellow wounds? A, remove dry eschar with antibiotic ointments. B, use a whirlpool for debridement. C, use hydrocolloid for the wound site. And D, use semi-permeable foam for the wound site. All right, let me get to the answers. All right, let's continue with the answers. So question number 1, the answer is D, 113 degrees. So you can rule out, like if you didn't know, you could rule out like the hottest and the coldest, right? And then you're down to 107 and 113, and then you have to pick. All right. 2, the patient is recovering from a digital reconstruction. So when are you allowed to start desensitization? Answer is C, after 2 weeks. So you might be able to remove stuff after 5 days, but after 2 weeks is when you are allowed to start doing even more. Number 3, you receive a script that says patient needs wound care. What do you do for a black wound? The answer is C, use topical antibiotics to soften up the eschar for debridement. When evaluating a wound, if you find debris like necrotic tissue, it's important to perform debridement to eliminate biofilm, and applying topical antibiotic ointments is also suitable for these types of wounds. So at the beginning, I think in chapter 1, I cite all my resources so that when you see page numbers, it's coming from Rehab the Hand 7th edition. This is the latest and the greatest when it comes to practice questions, because we developed them off of the latest book of Rehab of the Hand. And sometimes I include chapters because I think it's important to, because sometimes the answers aren't just coming from one concept, one page, but it's taking different concepts and putting it together. But for the lengthiness of the book, we just kind of identify a page or a chapter for you to like look through. All right. So it's just a little bit of a reference. I say that in the book just in case people are like, but what about this and what about that? All right. But she already look how thick she is. Can you imagine if I had to add more stuff? I would have to take away questions, and I wanted this book to be ultimately about practice questions. The more you do, the better you get, right? It's just practice. All right. Number 4, you get started on a thumb that's infected. What do you do? Answer is A, tell the patient you suspect he has infection and inform the MD immediately. Like, it's not like you can't still clean it. The best thing to do is you gotta take care of the infection, because when you inform the doctor, you can get antibiotics and things like that, right? Okay, answer Answer question number 5. What is the best way to address yellow wounds? And the answer is C. Use hydrocolloid. I'm sure I'm saying that word incorrectly, but don't correct me. It's okay. For the wound sites. And that is those are the questions. Let me stop sharing. So if you are studying, then check out this book. I'm going to include the link below. And if you need more help, there's free resources on my site. I have more videos just like this on YouTube. But if you're ready for some help, get the Ultimate Practice Questions. And I don't know if you know, but you can get this book free when you enroll in the Exam on Demand program. I have a special going on right now. I might actually take that out. Take the part out. If you need more help, not only from the book, but the Exam Prep on Demand can also help you study and hold you accountable to studying and keep you on track and structured. So I'm going to include all that stuff in the links below. If you need my help, grab it. In the meantime, you can find other videos just like this to help you, practice and get started. All right? Let me know if you need more help. Leave me a comment if you have any questions. All right? Talk to you next time.